Hello, my name is Dr. Suman. In this video, I will answer everyday questions about rheumatoid arthritis. Question 1. How do I know if I have rheumatoid arthritis? Because rheumatoid arthritis is an autoimmune disease, the symptoms may not be limited to the joints. In fact, you might not realize you're dealing with rheumatoid arthritis in the early stages of the disease. The initial signs of rheumatoid arthritis can include fatigue, a low-grade fever, and muscle aches. Many of the early stage symptoms of rheumatoid arthritis could easily be mistaken for a viral infection. Joint pain, swelling, and stiffness are often the main symptoms that occur as rheumatoid arthritis progresses. Small joints in the hands and feet are most commonly affected. Your joints might feel warm to touch because of inflammation. You may begin to have trouble holding a pen or opening a jar as your condition progresses. Rheumatoid arthritis affects symmetrical joints. This means that you will experience the symptoms on both sides of the body, such as both hands at the same time. As rheumatoid arthritis progresses, the attack from your immune system can affect more than your synovial tissue. Rheumatoid arthritis can also damage the ligaments and tendons that hold your joints together. You may also experience inflammation in your lungs. Some people develop firm lumps under the skin of their fingers, spine, heels, elbows. These lumps are called rheumatoid nodules. They are usually found on pressure points throughout the body. Many people with rheumatoid arthritis experience flare-ups or episodes when symptoms worsen. Some people who have rheumatoid arthritis also develop depression. About 40% of the people who have rheumatoid arthritis also experience signs and symptoms that don't involve the joints. Rheumatoid arthritis can affect many non-joint structures including skin, eyes, lungs, heart, kidneys, salivary glands, nerve tissue, bone marrow, blood vessels. Question 2. Can rheumatoid arthritis be prevented? There's no known way to prevent rheumatoid arthritis, but scientists are studying DNA markers that show that someone will develop it. They hope one day to find the trigger and prevent the disease. If you smoke, quit. That's one sure thing besides your genes that can increase your chance of getting rheumatoid arthritis. Some studies show it also can make it progress faster and lead to more joint damage. You also may be able to lower your chance by losing weight, especially if you are 55 or younger. People who are overweight seem to have higher risk of developing rheumatoid arthritis. And new research shows there may be a link between rheumatoid arthritis and periodontal diseases, that is, gum diseases. So there's another good reason to brush and floss and see your dentist for regular checkups. Even though there's nothing you can do to ensure you won't get it, keep in mind that early treatment can make your symptoms less painful and save your joints from damage. Ideally, you should begin treatment within 3 to 6 months of your first symptoms. Question 3. Can rheumatoid arthritis be reversed? Rheumatoid arthritis cannot be completely treated. When you have rheumatoid arthritis, your symptoms including joint pain and swelling can come and go. The time when you feel better and your symptoms are under control are called remission. Goal of your rheumatoid arthritis treatment is remission. It can make you feel like your rheumatoid arthritis has gone away, at least for a while. Not only do your symptoms ease while you are in remission, but your disease stops progressing. That halts lasting damage to your joints. Question 4. Who is at a risk for rheumatoid arthritis? Doctors do not know what triggers the immune system to attack the joints in the bodies of people with rheumatoid arthritis. However, there are some factors that researchers know to increase the risk of being affected by the condition. First, gender. Women are at a greater risk of developing rheumatoid arthritis than men. Second, age. Rheumatoid arthritis can occur at any age, but it most commonly begins between the ages of 40 and 60. Third, smoking. Smoking both increases the risk of developing rheumatoid arthritis and makes it progress more quickly. Fourth, environmental exposures. Although uncertain and poorly understood, some exposures such as asbestos or silica may increase the risk for developing rheumatoid arthritis. Emergency workers exposed to dust from the collapse, such as of World Trade Center, are at higher risk of autoimmune diseases such as rheumatoid arthritis. Fifth, obesity. People who are overweight or obese appear to be at somewhat higher risk of developing rheumatoid arthritis. Sixth, family history. If a member of your family has rheumatoid arthritis, you may have an increased risk of the disease. There are also some factors that researchers have found to decrease the risk of rheumatoid arthritis. These include, first, moderate alcohol consumption. A study found that moderate alcohol consumption was linked to a reduced risk of rheumatoid arthritis. Second, breastfeeding. According to a study, women who breastfeed have a reduced risk of developing rheumatoid arthritis. Question 5. How does rheumatoid arthritis progress? There are 4 distinct stages of rheumatoid arthritis progression, and each has their own treatment courses. Stage 1. This is early stage. This stage involves the initial inflammation in the joint capsule and swelling of synovial tissue. The swelling causes the symptoms of joint pain, swelling, and stiffness. Stage 2. In the moderate stage of rheumatoid arthritis, the inflammation of the synovial tissue becomes severe enough that it creates cartilage damage. In this stage, symptoms of loss of mobility and decreased joint range of motion become more frequent. Stage 3. Once the disease has progressed to stage 3, it is considered severe rheumatoid arthritis. Inflammation in the synovium is now destroying not only the cartilage of the joint, but the bone as well. Potential symptoms of this stage include increased pain and swelling and a further decrease in mobility and even muscle strength. Physical deformities of the joint may start to develop as well. Stage 4. In the end stage, the inflammatory process ceases and joints stop functioning altogether. Pain, swelling, stiffness, and loss of mobility are still the primary symptoms in this stage. Question 6. Does rheumatoid arthritis affect life expectancy? An exact life expectancy is almost impossible to predict due to the varying nature of the disease. In general, patients can expect that the rheumatoid arthritis life expectancy could be shortened by roughly 10 years to as many as 15 years. This is dependent on a number of factors including, but not limited to, gender, age, personal and family medical history, lifestyle, past and present, overall levels of health and well-being. Do not lose hope. Despite these study results, it's also important to note that many rheumatoid arthritis patients live well into their 80s and 90s, which is an average expected lifespan. Question 7. Can rheumatoid arthritis be fatal? Rheumatoid arthritis alone is not fatal. Fatality occurs due to complications associated with the inflammation caused by rheumatoid arthritis. In severe cases, patients can develop other medical conditions. The other medical condition that patients need to be aware when it comes to shortened rheumatoid arthritis life expectancy include heart disease, diabetes, stroke, cancer, especially lymphoma, respiratory conditions like chronic pulmonary obstructive disorder, infection. Question 8. Does the type of rheumatoid arthritis affect the damage and treatment? There are two types of rheumatoid arthritis, seropositive and seronegative. Seropositive rheumatoid arthritis means that you tested positive for rheumatoid factor. People who have seronegative rheumatoid arthritis do not have rheumatoid factor. It is still possible to have rheumatoid arthritis without these antibodies, but this may make it more difficult for you to get a diagnosis. Diagnosis and treatment within 6 weeks of experiencing symptoms can play a role in keeping your pain at bay. It may even make it more likely that your symptoms will go into remission. However, if your treatment isn't started or isn't effective, the inflammation can permanently damage your joints. This can make it difficult for you to perform everyday activities. Question 9. What are the complications associated with rheumatoid arthritis? Complications of rheumatoid arthritis includes osteoporosis, Jordan syndrome, which is dry eyes and mouth, infections, abnormal body composition, carpal tunnel syndrome, heart problems, lung disease, lymphoma. Question 10. What causes rheumatoid arthritis flares? Although the exact cause of rheumatoid arthritis flare can be due to a variety of reasons, some common factors are stress, infection, foods. Many people with rheumatoid arthritis and their doctors agree that certain foods may trigger a flare of symptoms, but exact culprits are difficult to pinpoint because the problem foods are different for everybody. Fatigue, pregnancy. Being pregnant turns off the immune system and usually causes rheumatoid arthritis symptom to go into remission. But the months just after giving birth are frequently a trigger for a rheumatoid arthritis flare. Question 11. How to manage the rheumatoid arthritis flares? Avoiding your non-triggers, managing stress, and getting enough rest are the best ways to avoid flares. Be aware of early symptoms of a flare. Once a flare starts, balance your rest and activity. Have a flare support plan in place. You may also need a plan at work to reduce your hours or do some work from home. Applying hot or cold packs may be effective at reducing joint pains and swelling as well. Reduce stress. Techniques that can be useful includes deep breathing, guided imagery for relaxation, meditation, or mind-body exercises like Tai Chi and yoga. Question 12. What to do once you know that you have rheumatoid arthritis? Drug therapy plays a major role in controlling the progression of rheumatoid arthritis. However, making lifestyle changes can also help you manage symptoms and make you more comfortable. First is exercise. Daily exercise may sound counterintuitive when your joints hurt, but it can be effective in reducing fatigue and maintaining joint flexibility and range of motion. There are types of low-impact exercises that can help your rheumatoid arthritis, including water aerobics, Tai Chi, yoga, Pilates, biking, cycling, walking, gardening, stretching, like warming up by walking in place or pumping the arms while sitting or standing for 3 to 5 minutes. Holding each stress for 10 to 20 seconds before releasing it and repeating each stress about 2 to 3. Using a yoga strap may help people maintain proper form while stretching. There are some hand exercises that can help reduce or prevent the inflammation of the fingers and the wrist. Start by holding your hand upright and pointing the wrist, fingers, and thumb forward. This also serves as the neutral starting position for many of the hand exercises that follow. Hold for 5 to 10 seconds. Exercise number 2. Wrist straight in the neutral starting position and bend the base of the fingers, which connect the finger to the palm. Keep the middle and end joints and your wrist straight. This is already a big effort for people with rheumatoid arthritis. Hold for 5 to 10 seconds. Repeat twice daily on each hand. Exercise number 3. Keep your wrist and the base joint straight. And bend your middle and end joint of the finger toward your palm, one at a time. Hold each position for 5 seconds. Repeat on all 10 fingers twice a day. Exercise 4. Bend each finger from the base joint downward using other hand to move the finger. Repeat this movement using second row of knuckle in the finger. Repeat this exercise on the third row of joint in your finger, closest to the fingertips. Hold for 10 seconds. Repeat on all 10 fingers twice a day. Exercise number 5. With your hands straight and fingers pointing upward, bend your finger downward so they are touching your palm. Do not make a fist. Instead, your finger should be touching the palm of the hand. Hold for 5 seconds. Repeat on both hands twice a day. Exercise number 6. Starting with your wrist, fingers, and thumb pointing upward. Make an O by touching your index finger to your thumb. Hold this for at least 5 and up to 20 seconds. Repeat 2 to 10 times twice a day. Exercise number 7. With your hands in the neutral position and all of your knuckles straight, slowly and gently spread your fingers as far apart as you can, like a fan opening up. From this position, make a fist. Hold each position for 5 seconds. Repeat on both hands twice a day. Apart from exercises, other things to be done in rheumatoid arthritis is controlling the diet. Diet changes can also manage your symptoms. Omega-3 fatty acids found in certain kind of fish, walnuts, and flaxseed products may reduce inflammation throughout the body. Foods rich in antioxidant vitamins C, E, and A may also keep your body safe from oxidative stress and cell damage. Some people with rheumatoid arthritis have noticed an improvement in their symptoms when they eliminate dairy, sugar, or gluten. Another thing that can be done when you have rheumatoid arthritis is support groups. Consider joining a support group for people with rheumatoid arthritis. A support group will allow you to share your feelings about the disease. Chronic arthritis may be something you have throughout your life, but it doesn't have to take over your life. Question 13. What to eat, what not to eat in rheumatoid arthritis? Now, foods to eat with rheumatoid arthritis are beans, broccoli, cherries, citrus fruits like oranges, grapes, and limes, fish like salmon, herring, sardines, and anchovies, nuts like walnuts, canola oil, and soya beans, ginger, garlic, turmeric, berries, spinach, grapes, tart cherry juice, olive oil, soy, whole grains like cooked oats, cream of wheat, brown rice instead of white, then almonds, legumes like lentils, dal, mung beans, miso and tofu, then lukewarm water or boiled water with ginger root to help with digestion and remove toxins, then green leafy vegetables, buttermilk, aged wine in moderate amount. And these are all the foods that helps in rheumatoid arthritis. Now the foods to avoid when you have rheumatoid arthritis are red meat and dairy, that is full fat dairy products, pasta dishes and grain based desserts, then corn oil, that's sunflower, safflower, soy, vegetable oils, and fried foods, fast foods, grilled foods, processed foods, then salt, sugar, alcohol, and refined flour, that's white flour bread and pasta. Then gluten, a protein found in grains such as wheat, rye, barley, may contribute to inflammation in some people. Question 14. What to do and what not to do in rheumatoid arthritis. Now, talking about habits. Go for absolute fasting or rely on a liquid or semi-solid diet for an entire day, depending on your strength, of course. You can follow this with hot fermentation, that is application of moist heat. This can be done by soaking cloth in warm water and giving a compress over the affected parts, or steam bath, or taking a bath with lukewarm water. Use warm water to drink and to take bath. Do not get exposed to cold breeze. Empty your bowels daily without fail. Do not control natural urges. Avoid staying up until late and afternoon naps. Question 15. What yoga postures can benefit in rheumatoid arthritis? The yoga postures that benefit are Vriksha Asana, or the tree pose, Setu Bandh Sarvanga Asana, or the bridge pose, Mrit Asana or Shavasana, or the corpse pose, Bala Asana, that's child pose, Apana Asana, that's knee to chest pose, Kapota Asana, that's pigeon pose, and Kapalabhati Pranayama. So now these are all the random questions that arise in everybody's mind regarding rheumatoid arthritis. I believe I have been able to answer all the queries clearly. If there are any further questions, they can be asked in the comments, and I will be happy to answer all the questions. Thank you.